Hello, medical terminology students. Like I stated, this week we're doing two chapters. I already went over chapter 14, which has to do with the skeletal system, and this chapter 15, referring to the muscles and tendons, and then physical medicine and rehabilitation. This chapter starts in your book on page 503. Okay, there are different types of muscles. And so most of the time people they think of muscles, they think of the skeletal muscle, but there are also two other types of muscles that we just a lot of times don't realize are muscles. So obviously skeletal muscle has to do with posture and movement and dealing with our skeletal system. But cardiac muscle, if you think of cardi and you remember what that term or that root word means, it means referring to the heart. So this has to do with the heart to function because the heart is, even though it's an organ, it is also a big muscle. And then we have smooth, which this here has to do with like peristalsis in our intestinal tract. And it's involuntary. We can't do anything with it. It just does it on its own. The functions of the skeletal muscle. Um, uh, so obviously the functions we already kind of talked about, but you can see the functions on page 506. It has to do with, whoops, sorry about that. We have movement, posture, body heat, respiration, and communication. Here are some root words that you probably need to know. So let's take a look at these meanings. Okay, so we are regarding the muscles, we're at the shoulder girdle, and there is a picture of a shoulder girdle on page 505. And regarding the muscles in here, these are usually like a little bit of a mouthful. So these four muscles here actually make up what we refer to as the rotator cuff. If you've ever heard the term, I tore my rotator cuff. Well, there are different muscles within the rotator cuff. And when you actually, get your MRI or CT scan, it's not going to say rotator cuff. It's going to say either subscapularis, supraspinatus, infraspinatus, or the teres minor. So just remember, they all work together, but they are still separate muscles, which you can see on figure 15.3 in your textbook. And then we have our upper arm, which you guys can look at on page 506. The elbow joint, you can see the different muscles in the elbow joint, and still on page 506. And then we go to the forearm, wrist, and hand. And I'll let you read this by yourself. And now we go down to the lower limb. This is on page 507. And you can see the different muscles starting off with our pelvic area, our thigh area, and then our buttock area, all the way down to just above the knee. And these are the thigh muscles. If you've ever heard, that I've got good quads, well, quad means four. And so the quadriceps femoris is going to be this area right here, but it's a group of four different muscles that work together. And then we have our hamstring muscles, which is going to be on the back side of our leg. And again, we have all of these components that work together. This is at the back of your leg. It's that really big kind of bulge right below your knee, the gastrocnemius. Okay, now we've got state the medical term for the following definitions. The heel bone. What is that? I know that was last chapter, right? Action of moving toward the midline. Muscle that moves the thigh toward the midline. and a major muscle in the back of the lower leg. Hopefully you got all those. All right, so now we go to the disorders and injuries of muscles and tendons. Fibromyalgia, polymyalgia rheumatica, myasthenia gravis, muscular dystrophy. So we've got some injuries of the skeletal muscles, which we have, muscle soreness, cramps, strains. But let's figure out what rhabdomyolysis means. And then tenosynovitis. Achilles tendonitis. And then in the shoulder girdle, we have rotator cuff tears, which we already talked about, tendonitis, bursitis. In the elbow, lateral epicondylitis. And then we also have, ligament strains and bone fractures. In the wrist and the hands, there's ganglion cysts, carpal tunnel syndrome, all right, so now we're procedures and pharmacology. So electromyography. Break it down, we can figure out what it means. Electromyography. Inflammation. This isn't a diagnostic procedure, so I'm really not sure why I have it on there. I really don't know. Sorry about that. But it does show you how to break down the term inflammation. So ultrasonography, and then of course a biopsy. Therapeutic procedures, we've got therapeutic exercise, manual therapy. There's things called drying needling, cupping, soft tissue mobilization, myofascial release, instrument assisted, physical therapy modalities, including electrical stimulation, thermal modalities, ultrasound, musculoskeletal drugs. We have NSAIDs, otherwise known as nonsteroidal anti-inflammatory drugs, including acetylsalicylic acid, otherwise known as aspirin, ibuprofen, naproxen, indomethacin, paracetamol, skeletal muscle relaxants, anabolic steroids, and the goal of some of these is to produce analgesia, which means the sensation of no pain. They all work in different ways. Like the nonsteroidal anti-inflammatories, they work on inflammation, whereas other medications, they just work to block the pain messages. They work in different ways. And then we've got our physical medicine and rehabilitation. There's all kinds of physical medicine rehabilitation. We have rehabilitation medicine. We have restorative medicine, which is different than rehabilitation medicine. If you want to know the difference, look them up in your book because there are actually definitive differences between the two because their treatments and therapies and end goals are totally different. Maintenance rehabilitation, the term activities of daily living, otherwise known as ADLs. That's exactly what rehabilitation, restorative medicine, and the maintenance rehabilitation, they're trying to either regain these ADLs or maintain these ADLs. All right, so some other definitions. So we have occupational therapy, physical therapy, physiatry, an orthotist, and then we have the term rehabilitation. Let's talk about amputations. When you have an amputation, obviously it's going to be the removal of a limb of some sort, and it could be as small as a finger or a toe or as large as an entire limb. There's reasons that you could have an amputation, such as peripheral vascular disease. You could have diabetes, where it causes an injury and causes where you can get an infection that doesn't heal. And then for people who have had an amputation, the goal is to get them rehabilitated back to their former self with whatever's new. So if they were walking before and now they had an above the knee or below the knee amputation, well, getting them into a prosthetic and teaching them how to use it, and then being able to resume their former activities of daily living. And that is it for this chapter. We're done for this week. Let me know if you guys have any questions.